Welcome to today's press briefing. We have with us the Head of Communicable Disease Branch, Center for Health Protection, Dr. Chuang Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Gladys Kwan. Dr. Kwan will give us an update about the Hospital Authority, and then Dr. Chuang will give us an update on COVID cases. Dr. Kwan, please. Good afternoon, everyone. We have 1,456 patients who are staying in hospitals. 187 of them are new cases. Those who are in isolation facilities, 440 of them are in isolation wards, 64 of them are in second-tier isolation ward, 448 of them are in North Lantau, Hong Kong Infection Control Center. There are 148 new cases. Yesterday, we report 3 patients in a critical condition, 6 in a serious condition. So far, those who are staying in hospital, there are 17 critical cases and 22 serious cases. 9 critical cases are in the ICU. We have previously announced a 22-month-old baby girl who have been confirmed. The current condition is still critical. The Eastern Hospital is closely monitoring her situation and provide her with suitable treatment. We have reported 3 new death cases, all females aged between 65 and 88. They are not from care homes. 1 has completed the vaccination course. The first case is an 81-year-old female. She's suffering from Parkinson's disease, had a stroke, and had asthma. She lives with her family. On the 18th of July, she had a fever, shortness of breath, and low blood oxygen. She received treatment at the A&E department. During admission, her condition was stable. On the 24th of July, she suffered from a cardiac arrest. Resuscitation failed. The case was referred to the coroners. The second case is an 88-year-old female. She suffered from hypertension. On the 17th of July, she started to show symptoms. RAT was positive. When she arrived at the designated clinic, she saw the doctor. She was prescribed with oral medication. Her condition has been stable. On the 24th of July, she started to suffer from speech impairment at home and weakness. And when she arrived at the A&E department, her condition was not good. We found upon investigation that there was an ischemic problem as her condition deteriorated and she passed away. The last case is a 65-year-old female suffering from breast cancer. The cancer spread to other places. On the 12th of July, because of phlegminess as well as coughing, she went to the hospital for treatment. Her lung condition worsened because of bacterial infection. Yesterday, she passed away. We had 139 patients recovered, including 132 who have been discharged. We have 6 patients that have been confirmed positive upon admission screening or when they're in hospital. 13 patients in the same ward and staff members have been classified as close contacts. We have altogether 26,011 staff members who have been confirmed, and 25,434 of them have resumed duty. At the Princess Margaret Hospital, there is a cluster. It's a geriatric and medicine ward. A 94 male patient on the 26th of July was tested positive. Subsequently, on the 27th of July, the hospital conducted contact tracing. It was found that a 65-year-old male patient was confirmed. On the 28th of July, we have already disclosed the information via a press release. Contact tracing continued, and it was later found that the 65 male share Three shared the room with 3 other patients. They are aged between 64 and 82. There is also one nursing students who have been confirmed on the 28th of July. All their conditions are stable. The 5 patients are receiving treatment in isolation. At Kwai Chung Hospital, a staff member was confirmed positive on the 20th of July. In the same ward, 3 female patients aged between 52 and 59 were also confirmed. The hospital is conducting investigation on the link. Patients have been sent to Princess Margaret Hospital for treatment in isolation. Their condition is stable, so is the staff member. In the same ward, 2 patients are classified as close contacts. Arrangements have been made for all patients and staff members to go through testing. These relevant wards have stopped admitting new cases as well as a visitation. Thorough disinfection and cleaning have been conducted. We'll closely monitor the health condition of patients and staff members. We'll also keep in touch with the CHP. That's all for my report. Dr. Zhang. Yesterday, we have local positive cases, 4,490 cases, including 1,557 PCR positive cases, and verified RAT cases, 2,933. We have 193 imported cases, including 169 PCR positive cases and 24 RAT positive cases. Dr. Kwan mentioned about the 3 death cases reported. There is one case informed by forensic pathologist. It's a 92-year-old male living at home. He needs home care. He had cardiac disease and had an operation. On the 22nd of July, he started to deliver a fever, and he took medications. The condition improved, but then there was a shortness of breath. He passed away. He passed out at home, and he was sent to hospital, and he was certified dead. He did not receive any vaccination at all. Upon admission at the morgue, forensic pathologists conducted COVID tests and found that he was positive. And it's found that the condition might have something to do with COVID. Currently, we have 9,289 death cases. Of the 193 imported cases, 78 of them are picked up at the airport, 94 of them are picked up at quarantine hotels, and 21 of them have already left the quarantine hotels. In relation to care homes, there are 4 homes with cases, so close contacts will have to be arranged. That is 3 elderly care homes and 1 care home for the disabled. They are Caritas Jockey Club Yan Fai Yun in Chun Wan. 1 staff member was confirmed. 2 residents have to be quarantined. The second one is Dong Ming Wu Lo Yun Bắc Se Wu Lo Fan Yun on an island. There are 1 resident that is confirmed, and 5 residents will have to be quarantined. In Fanling, there is a Fu Ging Wu Lo Yun Yao Han Gong Si. 1 resident is positive, and 9 residents have to be quarantined. There is 1 care home for the disabled is the New Life Society, and 1 resident was confirmed, and 4 have to be quarantined. Today is Saturday. There are 2 schools with confirmed cases. Some class suspensions will have to be put in place. First is the the Maritime School, Class 2A, 3 out of 25 students are confirmed. There will be class suspension for 1 week. And there are 3 students and 1 staff members. They live in a dormitory. And all these cases live on the 3rd floor. The 4 students plus 1 staff members have been confirmed. So those who are staying on the 3rd floor, altogether 46 students will have to stop going to school and vacate the dormitory. For仁愛幼稚園 in Southern District, there are 2 pupils plus 1 teacher that have been confirmed, so the class will have to be suspended. In relation to sublineage, we are monitoring the percentage. There is some increase for suspected BA.2.12.1 is between 4 to 5%. BA4 and BA5 is about 4 to 5%, so a slight increase. That's all for my report.
Questions, please raise your hands and use the microphone we pass to you. Before you ask a question, please identify the organization you represent. Any questions, please? On the right-hand side, in the 3rd row, the lady in green. Good afternoon, Dr. Zhuang. You mentioned a school with a suspected outbreak. Can you tell us the number of students in the same dormitory room and whether they have had any mask or activities such as eating or activities at school? And a question about the 22-month-old baby girl. She is still critical. Can you tell us the treatment protocol and tell us the treatment protocol in the future? Yesterday, the hospital authority relaxed the guidelines for prescription of oral antiviral drugs for those who are under 60 years old. Can you tell us the risk factors concerned, and will private practitioners that can prescribe oral medication, will they follow the same guidelines? Now first about the Hong Kong C School. 3 of the 4 students are from class 2A. So they might have contracted it in class. Another student is in the same dormitory as another. So we don't rule out the possibility because they live in dormitory, they may be sharing the same bathroom, and they might not be wearing their masks properly. And then there is also a warden infected. So the 40-odd students there have to suspend class for a week. And for the prescription of medication, I defer to Dr. Guan. For the 22-year-old baby girl, she is still in serious condition. Our medical team is giving her full support. Yesterday, we announced new guidelines for prescription of the new oral COVID drug. And it's just been a while, and we will monitor the data for the coming few days. The guidelines are the outcome of discussion by our expert panel, so they will be given to private practitioners for reference. Next, the lady in white in the last row.
From Field TV News. So why was the 18-year-old deceased woman not quarantined in the isolation center, but she was just at home? And then also the chief executive said today that the government is considering to turn some temporary hospitals and isolation center for COVID-19 patients to quarantine sites for travelers to headed to mainland. And how do you see the plan? And also we know that the scientific committee of the CHP is reviewing the figures of the inbound travelers from the past few months to amend the length of the hotel quarantine. So when will we know the amended length, and what you guys have discussed and reviewed so far, and how long will the amended quarantine be? Yeah, thank you.
I will answer the second and third question, but I'm not sure about the first one. Can you repeat?
Yes. You mentioned that the 18-year-old deceased woman, she was not quarantined in the she was she was tested positive, but she was not quarantined in the isolation center, right? She was at home, she was staying at home.
Yes, she was staying at home.
Yeah, so why she's
Okay. Oh, that's because this patient, I don't have the exact information, but from the medical record, we can see that that patient actually stayed with the family, and the family also diagnosed positive with the rapid antigen test.
下一位，左手。
Next. Dr. Zhang has yet to answer the questions.
The details on the community isolation facilities as mentioned by the chief executive, but I'm sure details will be announced once it's finalized. And I understand the Bureau is coordinating the analyze the inbound travelers, the date of detection, and I'm sure they will announce it once it's finalized.
下一位就呢邊左手邊最後嗰行嗰位女士。
This side. Good afternoon, I'm from cable TV. For the 92-year-old man who passed away, what do you think is his route of infection? And I'd like to know about the quarantine arrangements for the parents of the injured dancer at Mira's concert. Professor Hui said today that there are conditions for us to shorten the quarantine period in hotel. Perhaps it can be shortened to 5 days plus 2 days at home, or 4 days in hotel and 3 days at home. What is your latest assessment? Now, the deceased man required care. She might have got it in the community. He might have been in contact with positive cases. As for the quarantine arrangements for the family members of the severely injured person, there is already a press release. I don't have anything more to add. As for the arrangements for inbound passengers, when the secretary met the media today, he had made it quite clear. Next, speakers off mic. A long operation was done yesterday, and the case is now on a ventilator. Clinically speaking, when a patient requires such support, it would be counted as critical. But then the important parameters are still stable. The lady on the right. The vital signs are stable. With regard to the Hong Kong C school, for the 3 confirmed students, you know who's the source patient, and the school might have water activities. Are there any special features leading to this possible infection? You told us just now that there might be there is an outbreak and Princess Margaret Hospital. Is there any way to prevent a further outbreak in terms of arrangement of visitations? As for lowering the vaccination age to younger than 3 ages old, I'd like to know whether Sinovac and also BioNTech manufacturers are willing to provide lower dosages. Can you comment on this? Now, we understand that 3 students from Hong Kong School are confirmed, and this proportion is very similar to other schools. I do not see anything special about this school. The joint scientific committees will meet tomorrow. One of the agenda items is vaccination for toddlers. We'll have to wait after the experts have discussed this issue. Now we are concerned about infections within hospitals. First, the visitation arrangements. As said, visitors are required to have done PCR. If that cannot be done, or for compassionate arrangement, an RAT result is acceptable, but a PCR result must be given to us within 2 days after a visit. For colleagues, every day they are required to do an RAT, and twice a week they are required to do a PCR. Some may have to take care of high-risk patients, those with cancer in the blood department or and also a psychiatric stream. Now we will make similar arrangements, and for colleagues who have to work at care homes, they will be included. We'll of course monitor the clusters of infections in hospitals. So patients and visitors and our staff are monitored, and we'll see whether inpatients are suitable for vaccination. If so, we will encourage patients and their family members to consider taking this step, because for a full vaccination course, 3 doses are required. If inpatients have such a need, we can make arrangements for them. And of course, we'll communicate with family members.
Next, the lady in black on the far side. I'm from Mingpao. First of all, I'd like to ask Dr. Chuang. In relation to vaccination for those under the age of 3, have you received any application from pharmaceutical companies? Did they say that they would provide doses for children to Hong Kong? If it's 1/10 of the dosage, can it be done? In relation to the 22-month baby girl, have you conducted the genome sequencing test to find out if it is a sublineage? You mentioned about a ward in the Kwai Chung Hospital. Previously, several days ago, there was also another cluster in the same hospital. Was there any relations? Can you give us information about that cluster? How many cases, how many staff members, how many patients? Visitors will have to do PCR tests. Well, for people who have recently been infected, even if they stick to the guidelines, they might not be able to pass the PCR test. Are there any alternative arrangements for them? Tomorrow, the Joint Scientific Committee will convene a meeting. They will consider relevant decisions relating to vaccination for those under the age of 3. We will refer to the views of the experts before we elaborate further. For the baby girl, 22 months old, in relation to the strain she was suffering from, for initial genome sequencing tests, it seems to be a prevalent strain is L452L. I understand that Polytechnic University has conducted the full genome sequencing test is BA.2.2. Regarding the ward at Kwai Chung Hospital, it's not a new case, it's the same cluster. In relation to visitation arrangements, we fully understand relevant concerns. The visitors may themselves be still recovering, so we would find out more information in relation to that case. What's the PCR value? Would there still be symptoms? We will get more information before we arrange for visitation. Sorry, speakers off mic. Just give me a minute. There is no specific time limit. It's done on a case by case basis, so we do not fix the certain day. Sorry, I misunderstood the dates. They will convene the meeting on Monday. Last question. I'm from Hong Kong 01. For consecutive 10 days, we have more than 4,000 cases. What do you think the trend will develop? How will the trend will develop for the baby girl? If there is no interference and if it is a new strain, there might be more complications. What do you have in terms of preparation of treatment. The trend is a slow climb. We don't want it to be at a fast rate. We don't want the numbers to be great because we are concerned about the pressure it puts on our public healthcare system. So you're all reminded that vaccination is very effective in relation to reducing the risk of admission, serious condition, as well as fatality. So if you have yet to complete the full course, please do so. What's your second question? Sorry, speakers off mic. The interpreter cannot hear. The baby girl. Well, for toddlers, well, at the moment they are not for vaccination yet. So those who take care of them or those who are with toddlers should themselves get fully vaccinated. And if the young children are confirmed to have contracted COVID, then you have to carefully monitor the situation. If you're unable to monitor or be able to tell whether there are changes in the young person's condition, please send them to hospital. That's the end of today's press briefing. Thank you.